Good afternoon, my dear participants. We welcome you back again to St. Joseph's College, Trichy and Atal Academy jointly organized 5-day faculty development program on heritage management, a business perspective. I hope you all had a great lunch. The technical session 9 of day 3 commences now. With esteemed pleasure, I would like to welcome and introduce the resource person, Dr. Annamalai Periyan, Senior Consultant and Clinical Lead, Department of Emerging Medicine, Institute of Rila and Medical Center, Chennai, to talk about the management and emerging medical care. To mention about his career pace, he's a founder and honorary advisor of Emergency Care Skill Foundation, Tiruchirappalli. He is actively involved in the promotion and spreading awareness in emergency medicine in the community. He has been the member of the Royal College of Emergency Medicine, United Kingdom. He has also been the member of the Society Emergency Medicine, India. He's been a member of the Emergency Medicine Association, India. He's been the course director and the lead faculty for the Fellowship in Emergency Medicine in Bharat University. He has also been the course director and the lead faculty, Masters in Emergency Medicine, in the Society of Emergency Medicine, India. He's been the course coordinator and lead training center faculty for Diploma in Emergency Medicine course, Royal Liverpool Academy and Apollo Medversity, India. He's been the lead constructor and life support courses, American Art Association, and provider for European Resuscitation Council and Singapore National Resuscitation Council. He's been the lead instructor, National Trauma Life Support, India, and provider of Advanced Trauma Life Support Program, American College of Surgeons. He's been ex-chairman and program advisor of COVID vaccination program, Rotary Club. He has published articles in regional and national newspapers and conducted workshops in emergency life support and trauma care, conducted community emergency care awareness programs in various regions in TamilNadu for more than 7,000 people. He has actively led the emergency and the critical care team and designed the flow process for COVID management of various hospitals in the region during the pandemic. He's been a regular speaker in various national and state television channels to promote community awareness on healthcare. So without taking much of your time, I would like to hand over the session to you. Thank you, sir. Hello, sir. It would be great if you kindly unmute your.
Okay.
Thank you, sir.
So good afternoon all. It's a post-lunch session, and I think we'll make it a bit interesting, and I want it to be a more interactive session. We'll be happy to have a lot of questions from your side at the end of the session. Maybe we can also have a break in between for 5 minutes where we discuss about many things. So I would like to thank the organizers for giving me an excellent opportunity to talk to a very, very good intellectual crowd. And this topic is basically on heritage management and emergency medical care. As I've changed this into heritage management medical care, and as I talk to you on various aspects of management plans, that you will know about what was it done. So we've been talking about heritage management for the last couple of days. And health and heritage management is quite interesting, and as well as understanding health is quite a bit different concept. So we have a lot of heritage centers in our country, and I understand that UNESCO, these details and are known to you very clearly. So the World Heritage Convention was established in 1972, and there are about 38 UNESCO World Heritage sites in India. So, and you need to know that India is the sixth largest number of World Heritage Center sites in the world. So we have a lot of cultural sites and natural sites. About 30 has been decided as an cultural sites and 7 as natural sites. But when it comes to monuments and everything, so what is exactly heritage in medicine, basically, in healthcare? To be frank, it is what we think and what we believe and what we practice. So, so if you go to a village and you ask someone about what is heritage in your place, he may not be coming up with any kind of answer to you, because he's not really aware of what's heritage at all. But you know, if you ask him what you practice, what you believe in, he would come up with a lot of ideas to you. And if we start ranking all those ideas, finally you make sure that these ideas and practices have been transferred from one generation to another without knowing what exactly is or how important it is. Okay. So basically, heritage is something which is basically a practice which has been diversified. It is multifaceted. To be frank, multifaceted is it's so much that you cannot even measure it. So heritage is present from all aspects. So it's unmeasurable component, as if like it's a salt in the sea, where you cannot measure it. It's so blended, and it obviously handles a lot of emotions in with the common man. And it is evolving in nature. It's not static also. If we see that this heritage in the simple terms, these are things what people want and what we believe, what they believe in, and what they practice. And with this, what this medicine is also about. Its heritage in medicine is all about this. We've been talking about Indian history. We have Asian period, medieval period, modern period. So we are more concerned about medieval period. But what we talk about is modern period. Everybody talks about modern medicine, modern period, or modern heritage. But we don't think that they have the roots from the ancient or the medieval period. Though we say it's a Stone Age to the 7th century is an ancient period, it has been termed as that. The medieval period is termed as 8th century to 18th century. This period gives us a lot of information, a lot of values, the core values, the fundamentals have been all from this period only. Obviously, this is one of a picture which I have the sourced from Indian Gallery Science Exploration or Science City, Kolkata. So, okay, it's basically a photo of Sushruta. So hope people, many people know about him, and apart from people from medical fraternity, to be frank. Because medical school, we are not taught about a lot of things about ancient or medieval medicine or an integrated medicine. It is more focused on the modern medicine, which evolved more after 18, the early part of 18th century. So we think that about Sushruta, in Asian terms, we need to think about what he has done in those days without anything, what all he has done. Believe me or not, he has done a cataract surgery, and he was the first person to do a cataract surgery in the time. And doing a cataract surgery is not a quite easy aspect. But here we have a lot of technology now to do all those stuff. We have a lot of infection control practices which are being practiced. But believe, he has done some cataract surgery there. He has created change in a lot of people at that point of time. All he had is two things. One is courage which made him to do that, and which is what we need to carry on. The next important thing is, apart from the courage, he had few techniques, and he obviously believed that hands are the most valuable tool. Because we needn't depend on gadgets, basically. He started using hands as a tool. Then he thought about using few more gadgets. He designed his own tools, and they are the basis of few tools now. So obviously, you know that cataract surgery is done in a very different manner nowadays, where you take up the lens and then you replace it with the lens. but he didn't have the option of taking out the lens. He just pushed the lens into the inside the eye, so that something which is blocking is removed, so that the patient is able to get some vision. And obviously, he created a change in a lot of people, and he is the man behind everything. And basically, he's an Indian, okay, and has written a lot of the books. Okay, everything is written in Sanskrit, a lot of things there, and believe that its life was around 600 BC. He's not only called the father of plastic surgery, he's the father of Indian surgery. A lot of data which are available, a lot of techniques which have been adapted from his writings. But most of the people, we don't know about what's happening in the Asian world or the medieval part. We always talk about the 19th or 20th century. So the Sushruta Samhita is one thing which is available. There is only one copy which is really truly available in the world, and it has about 184 chapters with descriptions of around 1,100 illness and 700 medicinal issues. And there are a number of medicinal preparations which have been documented there. He adopted a technique called couching, and just giving all details about Asian medicine. Couching is basically just woven with threads and all the stuff. In the medieval period, what we think about is we always think that medieval period is dark and without reason, and that is what has been instilled in the minds of people, and we have been made to think about it. Especially in medical fraternity, we don't know about anything what is ancient or a medieval period. So this photograph, which is the sources from the Time and Tide Museum, Great Yarmouth, New York, it shows a human skeleton which has been excavated, and then on looking at, they found that there were a lot of bone fractures which have been joined or aligned together with a lot of copper beads and copper strips which have been done. So they've gone a lot of time. They've used copper as a material because they felt like copper has the ability to kill organisms, and they have used copper as a tool at the time. And they have also mended with bones at that time. So the medieval period, they have already had an idea about the base of that. There was an infection. There's a probability of infection. There's probably the copper was one of the strongest metal at that time available with them, which they utilized at the medieval period. That is one thing which you need to think about now. The most of the common medical practices have the roots in the period. So we have been talking about refining things in now, and we are talking about standardization of the flow process, standardization of the instrument, technology being involved. But all these things have changed a lot, but practice has not changed. The ethics, the core, what was followed has not changed. Those days, money was not the priority for people. Okay? They do it as a charity. They want to save people. They want to create change in the lives. That was the one which people had at that point of time. And that is a core value which has been traveled throughout generations. Only with that in mind, people have been transmitting all these things to the next generation. So that is an evolution which has been happening, but the core values have not changed. So heritage in medicine, okay, as we all know about it, we are always talking about folk traditions. And even in India, we always talk about native traditions, which have been existing for quite a long time. And these kind of folk traditions being followed by many people, and especially in the villages, people have a lot of traditions there. Maybe people who were on the pre-independence era or even before that, I don't think India had an opportunity to have good doctors in the rural villages. The modern medicine came up, people traveled all the way to learn the techniques. The people established, few people came and taught people what was right and what was wrong. But we had traditional birth attendants doing a lot of emergencies in the doorstep. Okay, they had to do deliveries at home at places where they don't have an option at all. There were also people called as poison healers. These are called as Visha healers. Okay, snake bites and scorpion bites, all these were very common. And these guys were really very smart. Okay, they had an opportunity to treat people, but they are smart enough to find which is poisonous, which is not poisonous, based on the signs and symptoms. Signs and what are the symptoms is what people tell you, or the sign is what people see. Okay, based on that, they have a good idea about to differentiate things and then work on it. So they also had an opportunity to treat with, with whatever they had, they were able to treat people at that point of juncture. So they were barefoot orthopedic tradition, which is still followed in few parts of Tamil Nadu. So if you have a bone fracture, they say maavu kattu. Okay, there's a traditional way of doing it. So they are technically very sound people. They do join bones, which are not complicated. But people at times, people land up with them and things can get complicated few at times because they get infected if there is an open injury and all those things. But they, at those point of time, they didn't have help. And these are the people who are, and they have been made successful also in doing that. And basically the household tradition in Tamil, they say is a party item. So everybody in the house has an option what to do, what not to do. They have their own beliefs, they have their own customs which are there. But one thing which lacks in this heritage is basically evidence-based and is scientifically proven or not. What we thought was right is right now could be wrong at times, because right now we are talking about few important things in medicine. We are talking about outcomes, basically. When you do something and you treat something, you need to have a good outcome. And we are talking about the morbidity of some kind of treatment. We are talking about mortality, how many people die and how the outcomes. We are talking about the follow-up of plans of it. And we are talking about complications also. So it's a quite tricky at this point of time, because medicine is a fundamental right for everyone at this point of time. So I have the right, I pay for it, I ask my questions. But this is not the same when it comes to an Asian way of approach. Asian way approach, people don't go to people don't think that is a fundamental right. Most people get treated at homes, basically. Initially, whenever you treat yourself at home, to start with, you have some ailment, do some kind of small things at home. You make sure that if you treat yourself after 2 to 3 days, if things are not getting better, then you have to travel to somebody and get treated. And that's a time where you have all these traditional folk traditions and all kinds of healthcare providers who have created a change in the people's life. The folk medicine is basically a mixture of traditional healing practice. Okay, it involves herbal medicine, spirituality, manual therapies, or even exercise in order to diagnose, treat, and prevent an ailment or any kind of critical illness. But one thing which you need to understand is all these kind of medical therapies are not for emergencies, basically. They are only to provide primary health care. So we had a lot of cultures over a period of time, and the heritage is through generations, which have used, they have used plant or plant properties to treat illnesses. We need to understand that scientifically we have a lot of drugs now, but these drugs are in these pills are in bottles everywhere. But the molecule is basically from some kind of plant source at some point of time. So all these things have nature, which they have contributed a lot to the origin of all these medications. The other important thing which you need to understand is basically nature plays a major role. Apart from it, as medicine advanced, we thought like we couldn't cultivate so many crops to get all this kind of materials, to resource materials to create drugs. That's the time where we thought of alternative thought, where the science played a major role, and we had molecules being developed, synthetic molecules being developed for the treatment of patients. So the traditional medicine and as a healing practice is as old as an human history. What we know is very little. It has been there since we evolved. It has been practiced mostly by indigenous or native populations around the world. Every country has an unique. If you go to Mexico, you have a different thought process. If you go to the Greece, Europeans have a different way of approach. Indians have a very different way of approach. It was the belief in every zone, every community, which evolved over a period of time. What's the problem with healthcare perspective? Okay, when it comes to folk medicine, so you go to a doctor and you just have a talk to him. None of the doctor believes on it. No doctor believes on it. You say that I had a native medicine for that. There is less kind of acceptance among doctors to do that, because they are in a modern world where their acceptance is quite low. And they don't like to talk about it. Basically, most of the doctors don't give an approach to that because they're not interested and they don't even listen to it. They always believe that it is deep rooted in spirituality and religion. And that is one which creates a problem right now. And because of that, most patients do not claim that they have such kind of traditional medicine which is being followed. Even if they don't come to the doctor questions them, most of them they don't do. especially in a city life where globalization is happening and there is a demand, fundamental right to get what they want, and things have changed a lot over a period of time. And these needs to be taken in mind. So there needs to be a tradition where there is an integrated way of approach, involving the traditional approach with a modern way of medicine. People are really afraid that a healthcare professional will judge or ridicule them on their belief systems. You know that a lot of people still believe on prayers as a prayer, and they feel that they have healing abilities. Few communities, few religions, but how far it is evidence-based is still questionable. But there are few traditional approaches which are widely accepted, which needs to be discussed very badly. So what are the problems with the traditional healers and basically heritage and these kind of heritage to be carried over to the next level, especially in case of medical field? It's not recognized by the government. No traditional healer can come and say that I'm trying to do that, because you cannot do that. In case of medical complications, you have a lot of problems. You consider as a quack in the practice. And regulating traditional healers is a challenge. There is nothing called traditional healers regulations authority or something. It is very difficult to do that because each and every region has a different way of approach. And there's a lack of collaboration between healers and doctors. And none of the doctors in the modern medicine believe in healer who does miracles. Okay, he needs to substantiate, he needs to substantiate, but he doesn't have evidence on it. He believes on something which has been carried on generations and is transmitted to his father, to his grandfather or mother or whatever it is. These guys could be very strong in monitoring outbreaks. Sometimes sudden outbreaks in some kind of region, these guys will have the thought process. But even if they come out with this, nothing is accepted in the society. The government may not accept it so warmly that this has been true or not. And these guys, traditional healers, basically, they ensure that more compliance with the people. Most of the people in the village, they believe traditional medicines and they feel that the person is a healer and he's going to create change in the life, and they have good compliance with him. But if you make the statement, it is truly not accepted in a medical fraternity. So it's quite difficult for a heritage to carry forward now. We need to look into a lot of these things when we make some decisions on management plans. We have a lot of doubts now. Traditional measures in emergency, will it work? Is a big doubt which we have. And then we can ask ourselves, well, it is a belief. Does it have an outcome? That is what which thinks. And then it is serve the primary healthcare at its best. These are a few questions which we need to question ourselves. The traditional measures in emergency, in case of emergency, it is very tricky and may not work at times. Okay, it is a trial-based approach. Okay, there is no evidence behind it. There is no scientific approach behind it. And the follow-up is quite difficult. It is a belief that these people will have a very good outcome, but there is no tracking process in it because we are talking about a very smaller people, smaller community. So it is quite difficult to make statements that traditional healers have a very good outcome, still doubtful. Then we're talking about primary healthcare. As I discussed, they are very good at primary healthcare. They can diagnose things, they can do a better job in a community level. But can it do the best is still questionable. It cannot be done because they don't have a follow-up system. They don't have an advanced care. Things get complicated, they don't have an advanced care. In ancient times or even pre-independence era, when we had a lot of wealthy people in the society, these people may not have an opportunity to go and meet a doctor at times. They make sure that they have initial treatment at home. So what to be sick before early 18th century? If somebody becomes sick, we have a situation which needs to be discussed a lot. It was a crucial era. It is surprisingly similar, but it is shocking. Why do I say similar? We have a COVID pandemic now. The situation is almost similar. You have everything, but you don't know what to do. It's quite difficult because we don't have a plan of action. We don't know what the infection is, what is going to happen, how people are going to affect it, and what extent the disease is going to spread. And we really have no idea because we don't know what is it. And we don't have a drugstore, we don't have hospitals, we don't have pain management, I mean anesthesia, okay, to do some surgeries or anything. We don't have anything. It could be a very crude way of approach.
Hello, sir. Extremely sorry for disturbing the session, sir.
Sure.
From your side, we could hear some kind of sound from your mic. I think the problem is on your side.
Okay, can you, how about now?
Yes, it's clear, sir, but frequently we could hear some kind of an extra noise while you're talking, sir.
Okay, just a minute.
Yes, sir.
How about now?
Yes, sir, it's correct. It's perfect, sir.
Okay, I'm sorry. Taking a class in the direct room is quite easy rather than taking a class in an or a discussion in a place. I don't see people, I see myself and talk. It is the most difficult thing in the life.
Yes, we could get it, sir. We could
Okay.
get
Shall I,
it.
shall I continue now? Is it
Yes,
okay?
definitely, sir. Thank you, sir.
Okay. So it's a crucial era where it is surprising. As I told, we didn't have any kind of drugstores, or hospitals, anesthesia, anything. And believe me or not, think something done in your kitchen. And that is what I always think about. A surgery done in a kitchen, a delivery done in a kitchen room. We don't have hospitals, and it's quite difficult situation at that point of time. And we did face such difficulties in our pandemic situation in COVID center. We didn't have water, we didn't have space, we didn't have resources. We have never seen people on roads, on structures, on ambulance. So this is basically what I'm talking about. The scenario is almost same. We had such experience in the past, and that is basically heritage which has taught us a lot. Ordinarily, we treated them in their homes, but someone or the other who might not be a trained physician. We don't have a trained physician at that time. Only the family members, the neighbor, or a midwife who's not trained will take care of the patients. The patients are too poor to pay at that time. To be frank, people don't have money at then. It is an exchange of various things at that point of time. Previously, I have told that they didn't think that medical care was a fundamental right at that point of time. So the situation is exactly worse when somebody becomes sick in the early things, 18th century. And life expectancy, okay, in the Western world, believe me or not, even in Europe and in UK, there is a data showing that in around 1300 to 1400 AD, the expectancy was the same, 30. And it didn't increase around about 40 for many years. And whenever there was a epidemic, okay, the death rate was quite high because they don't know what they are dealing with. So in India, before independence, the life expectancy was less than 30. Probably in the Western world, people who were rich, who were able to extend their support or able to gain the support from someone, had a life expectancy of around 45 to 50 at that time. Believe me or not, now the life expectancy in India is 69 years plus, maybe 70 years is an average life expectancy. This is all about the modern medicine, which have got the basics from the old medicine. And then we have changed the way we practice over a period of time. So what is the reason behind this in the case of the medieval period? Okay, we had a grim realities of the society. There was a food scarcity which can happen. There were an exhausting work which the people had to do. People don't worry about anything. Their living conditions were poor. There were poor sanitation and water supplies basically were very bad. Even now, even there few years back, people had to travel long way to get water basically. And in case of drought, they may have an opportunity to travel to some place where they can get water. And that was the situation even in India. So thoughts and plans, okay, most ailments where in the terminology of the day is self-limiting. So we always believed that most of the diseases are self-limiting at those point of time. Nobody goes to the hospital on the day one. They take care of many things. Even now we say the same thing. Always your body has a immune response. Your body can tackle many things on its own. There are emergencies, there are urgencies, there are certain things which can be managed very conservatively. So these conservative treatments have been carried from ancient people through medieval period and now. And few things are really have proven benefits. But in emergencies, we don't have an option of self-limiting things there. So most of the time they had domestic treatment done in the villages or in the homes or anything. And few people have even recipe books in their home because they're more worried about health. Health, they felt it is more of nutrition. Food was one which they believed a lot. So they believed that good food can have a good health, and they always sorted out for it. But now the things have changed a lot. So we'll be having some discussions on that. So even the wealthy did not opt for higher rescue plan yearly. So food as medicine. So I think nobody will deny me that food is medicine, but now medicine is food. So nowadays everything we wanted a medicine, and we are not sure what we eat is food or medicine. So that is still questionable still. So there is an heritage in everything. So if you go to different parts of India, okay, it is very diversified. They have a different way of approach. They feel that these are healthy. This kind of food is nutritious. This kind of cooking pattern is really good for health, and we need to pull out all these things to carry it forward. We don't have a link between different regions. Okay, different regions. We have cultural heritages which are being followed, but it's more focused and it is more regional rather than making. Maybe now technology and we have a lot of social media, social channels, which where people have taken up part. But I think still there's a long way to go in this. And this was one of the reasons where people were able to live on that point of time for a longer time. So this thing I just wanted to highlight it, and this is in 1300, the 12th to 15th century. This happened in Europe. It's basically Black Death. It's Black Death they are talking about plague at that point of time. There were almost 20 million deaths in Europe, where the spread and the impact was disputed completely, and nobody had an insight what was really happening to it at that point of time. But on working on this history, this gives a lot of information on how to handle an epidemic, what exactly happened, what were the difficulties which are faced, and all these things can are so valuable. And this information has given us an experience to do that. We are always looking out for experience in last 2 centuries. There are things where we have learned a lot. And the same way as the pandemic, COVID-19 pandemic, believe me or not, we had 45 lakh people who have died in this world, okay, because of the pandemic. We have an extraordinary technology. We have an extraordinary medical resource setting all over the world. It is not that we are talking about a developing country and a non-developed country or a developed country. Okay, wherever it is, the things have been worse because expectations are different. We are not really true. We are not really aware what we have dealt with. So this is the plan which we need to get it from what we can. So we are all talking about herbal remedies. We need to accept that herbal remedies are fruitful. There are evidence based on it. And I think the government is also promoting, the Ayush is coming up with a lot of plans to promote everything. And that is basically from a past. So there were few more remedies which were followed in the past, but nothing is proven evidence based. But there are certain things which have the basis has been done. For example, they feel that there is an evil spirit in the mind, and they feel that somebody has drowsy and everything. They make a hole in the skull to find out that there's nothing wrong. If somebody falls down and somebody becomes drowsy, they feel that there's a blood collection in the brain. They need to put a hole in there and let out the blood so that they become all right. These were basic ideas. We are still following the same thing, but the extent of thing has gone different. There are videos even on many channels where we show that, like in the ancient past, where people used to put a burr hole in the brain or do a craniotomy, basically cut the part of the skull to relieve everything. We always got medicine through time. Over a period of time, from Asian, medieval period, modern times, we always boast that we have the best advanced medicine till now. So are we really true in doing that is still questionable, because whatever we do is to make us healthier and live longer. The basic principle was the same in the past and even now. We want to be healthier, we want to be living longer. But all these advancements may not be the only thing which can extend the life. There are a lot of things. We have social factors, we have environmental factors, we have cultural factors. Various things governs it, and we need to think about all the stuff. So my entire talk is basically to give you an insight about what exactly Asian medicine thought process was, and what exactly now we have a thought process. Have we really get all those stuffs from them or not? Are we trying to adapt it or trying to deviate from that process or not? So this will help you to think forward. So we are talking about health components. Okay, we had health components is basically 6 components. We'll be talking about spiritual, we'll be talking about social factor, we'll be talking about emotional factor, environmental factor, and many more, occupational and everything. So you need to understand that all the components of health needs to be fulfilled. So if you were planning for some kind of heritage management, okay, and heritage management on health, basically, all these things needs to be taken forward, and you need to think about how this can be implemented, how things can be made fruitful with a lot of management decisions with core ideas. So mental health is basically self-esteem, confidence, and all those stuff, and physical health is diet and exercise and sleep, avoiding alcohol and drugs, I hope. And spiritual health as a sense of purpose in life, follow morals and values, feels a unity with human beings. I think we are now more focusing on spiritual health. It is a part of it, but there are other aspects which also needs to be concerned. I think people cannot deny that we are in a very stressful world where we are thinking about stress busters. What could be done? Okay, we are not talking about health aspect, but basically health is a part of it. But they wanted to have some kind of relaxed mode. They're looking out for some kind of support. So we have a conservation questions and we questions on approach. So when we make some decisions, we need to make sure that we have certain questions within ourselves. Okay. Does this action enhance the significance of whatever you do? Okay. So you need to make sure that your actions speaks a lot. Does it have outcomes or not? If not, can it be modified? Maybe your agenda is modified so that it has a neutral on conserving it. If not, will it jeopardize the significance of the future? Okay. The decision needs to be very clear from your side. So your actions make sure that it needs to have an outcome, good outcome. So you need to have all these questions when you do that. So multiple aspects associated with heritage and management is basically even health. We have a lot of things which we'll be talking about. But there are few concepts which we need to carry on forward. We need to scan, we need to screen, we need to replicate and create. So what does it mean by scanning is something like we are going to look out for what could be done better. I told you it is a belief and the practice. We need to screen it. We need to scan things. We need to screen all the beliefs and whatever people have it. And we need to just track forward to find if you could get some heritage which could be adapted, which could be changed, utilized for the people, because it's finally everything is for the well-being of the people. Understanding how people were before and how things could have been adapted to change it, what are people's well-being. And we need to make sure that we replicate to the next level and create a system, okay, and we can go live on it. It is an evolution basically, but we can have this kind of concepts when you have an approach on health and heritage basically. We do adapt ourselves. We start museums. Probably we have few museums there where we take it forward to show people that this was the heritage, which Asian heritage, which was followed. But still, believe me or not, whether it is carried on further is basically different. It's a tip of the iceberg what we think about, wherein we project certain things which could be more sophisticated to do it. But I'm talking about something, the belief and the practice, which needs to be taken back for some kind of research and development process. So we need to upgrade our theme of heritage. What are we going to do? We need to make sure that we upgrade it off and off, having the basic process of preservation, conservation, and then going for management. So now what we are planning for it, management and at different levels. So we need to have a theme in place, and we need to make sure that we focus 360 degrees rather than I told you now about talking about the tip of the iceberg. I personally think you need to have a 360-degree approach, and the awareness is what is wanted now. Awareness at different levels. There could be a lot of financial inputs in it. It could be from the government, non-government agencies, or maybe social interest people, volunteers, and there could be a lot of people who can do it. But still, your awareness should be more focused, and it needs to be on a management decision plans. And you need to make sure that you incorporate heritage in health at all times. So, for example, in the Western world, what they do is they have a trial-based approach. Look how heritage can be promoted or heritage can be involved in the patient's well-being. For example, patients staying in the hospital are being given, or patients who are mentally disturbed, or patients who are not doing okay with psychological and emotional disturbances, they are being involved in heritage management. For example, they take up certain things, they create replicas of those, and then talk to them on the heritage, make some interest on them, know if they are happy touching that, feeling it, and they have changed the way the practice is now. So it has created some kind of outcomes. So health, they are mutually helpful. Health is mutually helpful to them. You need to make sure that you go for the integrated medicine approach. So as of now, the integrated medicine is not widely accepted nowadays, and still there is a lot of hope that this will be into light. Modern medicine, it needs to be there needs to be regulations which are well designed to have an integrated medicine in place, especially in India, because it could be there is a lot of scope for exploiting or whatever the resources we have, and that is to me is a matter of concern. Unless until it is scientific and evidence focused, it is very difficult to have an integrated medicine. And we need to make sure that we drive ourselves and make policies to make sure that the integrated medicine goes to the next level. And obviously it needs to be technology driven. In this era, everything is technology. So we need to make sure that we have a technology to track things, the process, the flow, and everything. So these are the basic concept which we can get incorporate when it comes to health and heritage. Basically, there's another concept called as health and retreat centers. So this is coming up basically nowadays. Basically, see, we are talking about heritage centers. We are exploring things when we talk about heritage centers. There is obviously a lot of tourism involved, a lot of jobs involved. So now, as I was discussing, now people want some kind of break. They want to be a peaceful. They wanted to have something which is more interesting, an environment which is safe, which is unique, and it expresses heritage. It regenerates their mind, body, and it also gives some energy. So as I told you, when you start having a plan on retreat centers, converting the heritage centers to retreat centers, that could lot of help in the health, general well-being of the individual. As I told that people always wanted three important things which was well-being. One is basically good food, nutrition is food. They're looking out for good stay, that is the next important thing which we're talking about. Then they're talking about the health. Health is basically physical and mental health. And sports also play a lot of role in this. So this retreat centers can obviously change the way heritage is carried forward. The thought process on health and heritage. So talking about all those stuff now we are talking about emergency medical care. So the thing is very unique. So how far the general primary health care is very important. How emergency medical care is very important. There has been a lot of discussions on primary health care, but emergency medical care or emergency medicine care is still not discussed widely, because the importance as heritage is how important is an heritage. Emergency medical care or emergency plans are also very, very important. We always have a questions now. Let's throw some questions now. Is it worth to know? As a common man, there are a lot of practices which are being adopted in the community level, which has been carried through generations. And are we ready to know about that? Are we ready to validate them? Are we ready to incorporate them? How safe it is? And still, there are certain practices which are followed, which people are not even aware of. So I think it's time to go about next level to find out those stuff, bring in and do it. How is it going to benefit? What is the point in doing all these things, going all the way to find out how these medical emergency medical cares could support us or not? This is all the benefit. Finally, it all lands on the patient. If anything which benefits a patient is going to be of more uniqueness. And there are a lot of heritage, medical heritage, which is prevailing, which are still underused or still explored. When many countries have gone forward to find out so many things in the community level, find out everything is there or not, evidence-based approach. Still, we have a lot to do in an Indian community. There is always a scope to know about it because we have natural remedies. We have a lot of things still available in our society, which is underexplored. Where and when? It's when is there is nothing question called when is now is the start. Now is the time to start it, and this needs to be done. Do traditions contribute to it? Yes, is the answer. We need to believe in it and make sure that we start working on it to know the traditions and work traditions. So learn to teach principle contributes. So we need to make sure that we start teaching people. Okay, knowing is different and teaching is different. So it needs to go from one step. Is first learning is one of the things which we are worried about. We learn it, then we need to make sure that we teach people, and then we make sure that we spread it. So learning, teaching, and spreading is a part of the job to have a very good outcome in case of medicine and heritage. So just now, I think we have gone to an process of knowing how things could be helpful. But I'm now just going to think about one thing as an immediate life support. As an heritage managers, you're going to be working in different place where you're going to work on exploring things. We need to take care of yourself, your employees, your people around there. It needs to be a safe place. So whenever you work in a place, the facility needs to be very safe. You're worried about your facility and you're worried about your people there and you obviously. So you need to have a safety approach in case something happens to people there. What kind of emergency support you need to have? You need to have an exact flow process. I understand you do some excavation or some kind of exploration somewhere in the middle of nowhere. We cannot answer that. So have a backup plan how to do it. So the backup plan is training yourself on emergencies. So training people on emergencies is a priority as of now, right from right from your business starts. Okay. So knowing about emergencies, the first thing which you know to is if somebody collapses or somebody is brought to you with no signs of life or whatever it is, you need to know how to identify that this patient has no life. So obviously call, look for response, pat them, shout loud, and say obviously he doesn't have any life. And then you're going to look whether he's breathing or not. If you're not very sure he's not going to breathe, then you're feeling that there is no life. There is always a possibility that we see in a lot of movies where people look for the pulse. So it is always there is a lot of research on this saying that if you're not a technically sound person, difficulty there is always a difficulty in finding out or feeling the pulse properly. And people look into the hands basically. Hand is not the place where you look out for. So when you're sure that there's no signs of life, what you do is that now the answer that the heart has stopped beating. Now you need to make sure that you need to restart the heart. At that time, you need to make sure that you do chest compressions. So is this topic more related to this? But it is a life-saving information which needs to be incorporated in the minds of everybody who is at the site, and that needs to be done. So you need to know the skill set of bringing back someone to life. If there is an opportunity, try to work on it. Learn the skills. So you look for response, no signs of life, you assess the breathing, and still you feel that this patient is not breathing. He doesn't have any movements. Start chest compressions. So when you do chest compressions, you need to make sure that you need to be fast enough and try to do as much as possible. Believe me or not, it is an attempt to save life. It is not that if you do that, this patient is going to come out of life. So you need to make sure that you keep your hands or your palm of your hands in the center of the chest and start compressing this paper. Start chest compressions. There are a lot of academic courses also available already. You are always welcome to do that, to know these things. and general emergencies, how to handle such scenarios. For example, somebody has a fit there, somebody becomes drowsy, what is going to do? Somebody is a diabetic now, which is a very common problem now. Patient and people working in a setup where people suddenly becomes drowsy. He's a known diabetic, he has not taken his food, he works day and night in the place. And that's the time where you're thinking about there could be low sugars. How to treat such patients is something which you need to think about. And what could be the available resource setting which you need to prepare before you go to such places. So all these things needs to be taken in mind. I'm talking about few things which we need to think about. The most common is becoming low sugars with which is more common. Fits is more common. And you're going to obviously look into a lot of things like bites, snake bites, you have scorpion bites and everything. What should be done, what should not be done? It is not in the purview of this discussion, but still I need to talk to you on this. So you need to make sure that immediate life support techniques are there. You have a kit in place where preliminary data can be saved, or you probably in a workplace, you may have a safety data sheet for every equipment. I personally believe that you need to have a data sheet for how to proceed in situations so that you have a backup plan. So health is also a priority in such places. This can also happen in heritage sites where the tourist comes in there and suddenly a tourist collapse. You don't have obviously a clinic process. You don't have a clinic wherein you have a trained person and a doctor there, and it's quite difficult there to do. But if you have a trained personnel there who can do it, that's quite good for the patient. And you need to have a plan of care where this patient can be transferred, how to be transferred, what is the process involved, and all these things needs to be designed. Sorry. So these are the things which you need to keep in mind. So life is fast moving and we have a lot of stressors which people are right now. Diabetes is something which is alarming as of now. And we are the diabetic capital of India, and people are obese, people smoke, people drink, lack of exercise, sedentary lifestyle. We don't do any kind of checks as do before because of our lifestyle change. And finally, what happens, like, because we have such kind of lifestyle and we end up in some problem, we still don't know what can happen to us. So all I want you to learn and think about is knowing about handling emergencies in a setup where you can help people. So I'm just close the discussions now, and certain points to remember when you handle emergencies. There are usually 5 important things which you do. Your safety first, and then whoever is there, victim safety, whoever it is there. Make sure that your safety is a more concern. If you don't know, please don't do. Always call for help, and make sure that you do something. You reassess the people at regular intervals, and make sure that you have some kind of response to them and activate help at earliest. And if you're not sure, always think that it's not there. So for example, if you feel that there's no life, always assume that there's no life. That is how you need to take our messages there, and make sure that you don't cause any harm to people. And that's the usual practice where we harm people by our actions. That's the reason why I say that if you don't do that, call for help at the earliest, and make sure that you have a plan of care to transfer the patient to the right hospital or right healthcare setup where you can do that. The problem is basically you're transferring this patient to a small center. The small cut in the hand may need a small OPD setup where you can intervene. Somebody who's losing his life, or somebody who feel that have a very grave problem, or you're not sure what's happening, this patient needs to be transferred to a definitive care at times. So the chain of survival for every individual in any place depends on various things. One is basically early response, or knowing what's happening, finding out there is no signs of life. And you need to intervene and make sure that you're transferring to them to a definitive care. And this is very important. Any problem with any single step is going to reduce the chance of survival in anybody who's been affected. So I'm just saying some photos to you for knowing the response. You just shout loud and call, and make sure that there is a response or not. If there is no response, you always call for help. Help can be in different ways, calling somebody who's near you, or make sure that you activate an emergency care plan, call for an ambulance. 108 is a call number where you can call, and then you need to make sure the chest compressions are done. The chest compression is done for somebody who doesn't have life. For example, you start doing it, you place your hand in the center of the chest, make sure that you lock your fingers, and you make sure that it needs to be straight. You see the diagram that the straight arms needs to be there. Make sure that you are close to the body as much as possible and start chest compression. When to stop chest compression is basically when there is signs of life. What is signs of life? If somebody wings his face, moans, or just moves their hands and legs. Okay, that is a sign of life. Let me stop. Let me call for a definite help and reassess the patient regularly to find out everything. How much time you want to do is a question. Try to do as much as you can. If you can do it for 30 seconds, whatever it is, 1 minute, 2 minutes, or you have help, please continue it till there is signs of life. As I told you, it is an attempt. It is not the absolute one. You try to do something. You have an opportunity to save life. And these are defibrillators or something like that. These are machines which are attached to the chest. I obviously feel that this needs to be in any place where such emergencies can happen, because you don't have an advanced care anywhere nearby. So these machines can sense, and somebody heart is not stopping. It's stopped, and it is not. It's been creating some abnormal rhythms that can be put past, and you can restart the heart by this machine. It's called as an automated external defibrillator. Just to keep you aware of it, I'm just doing this. So finally, as a conclusion now, health and heritage is going to be a challenge. It is going to be a challenge every time, because it's an evolving process. We must participate, we must contribute. The main thing what we have in our mind is we are not participating, we are not contributing. So it is health and participation, and it needs to be there. I understand that it is the important issue in the world as of now. Health is so important. We are in the middle of the pandemic. We're expecting a lot of waves, and it's a part of life, but still we need to get prepared. I hope heritage and medical care syncs to each other, and we create a change in the management of heritage. Thank you. So, any questions, please?
Thank you, sir. We had an excellent time. Dear participants, you can post your queries in your chat box.
Not sure how to see the chat box.
Yes, sir, there is a question.
Can I see the chat box? Just a minute, please.
I'll read the question, sir.
Yeah.
Is there any difference between traditional medicine and community medicine?
To be frank, community medicine is a part of everything. Community medicine is in exploring the community, what the need of community. Okay, so traditional medicine is an entire process, but it has also an overlay in the community care. It has an overlay in the community care. Traditional medicine is what we are talking about. Long terms, we are taking up a lot of ideas. We are following it up. So you can incorporate this traditional medicine in the community care, but it needs to be validated and it needs to be approved. Because now we are in a medical world where everything needs to be validated and approved. If not, things can get a change in a different manner. The person who is doing it may be sued, or he may even be behind the bars of his negligence. So community care as an involvement of traditional medicine. Now Ayush and everything is basically community care. It's a part of the community care. They now government has brought in a lot of initiatives, a lot of support to bring this in place. Because it is an integrated medicine needs to come in place. Maybe few modern medicine people may not be accepting it, but it has its limitation. It needs to be regulated.
Thank you, sir. And one more question from M. Chinna Sanjeevan. What are the possibilities to get back the old medical treatment?
I think you have a process in place. It's a very difficult question. I told you that we need to screen that. That's a process I thought about. It is just all my wordings basically. You need to basically scan. So to be frank, I'm from the southern part of TamilNadu. So I'm from Chettinadu. That is a place where you go out there. There are a lot of buildings there. Once you step into the place, you really don't know what exactly the importance of each and every place. So you have somebody who is there living there for 100 years or 50 years. We should not talk to someone who is 20 years of age, because all the data is given by this 20 years of age is always wrong. If you go and talk to them, and that is the only way you know the importance of it, whatever it is. You go to a place, there will be hundreds of swards in there. You don't know why exactly the sward is. But still, it is a screening process which you need to do. It is a difficult process, but you need to make sure that there needs to be a lot of support from hospitals also. Hospitals and NGOs and volunteers who can frame a plan and then start it as a project. It is not going to be done in a day or so. it needs to be done and a lot of inputs which needs to be done. It's a very right question, but I think there is always a process in place for any kind of managerial issues. But here it needs to be ground reality, and it needs to be you need to go on the streets basically. That is the only thing.
Yes, sir. The same person has extended the question like, mean traditional medicine means, can we expect support from allopathy?
And that is what I told you. I'm also talking about integrated medicine. So traditional medicine, unless until it is evidence-based or approved, there needs to be a regulator body. Now what we need to do is we need to have a regulator body. The government should have a policy. This regulator body should validate all these things. And they need to make sure that if they have a research and development where you need to publish some papers or research, to be frank, you should understand that evidence is created. Even allopathy, whatever it is, evidence is created. I always feel evidence is what is created by humans. So, but it needs to be validated by a fraternity. So there needs to be a consensus between allopathy team and as well as the non-allopathy groups, where we come up with a plan. It's an integrated part. Let's do it. And you incorporate this heritage treatment plans in the community, come up with the plans, and then you decide on whether it can be carried forward. Because see, one community commenting on the outcomes of it cannot be accepted for this. For example, Ayush, for example, COVID. For example, COVID is basically a viral illness. It's a viral illness. So there's always a saying that you treat it for 7 days, you don't treat it for 7 days. After that, viral illness goes away. This is the usual saying. COVID is a normal thing. So the death rate is less than 2% or 3%. We don't know who is going to get affected. But see, there is a treatment plan is basically supportive care. So understanding what exactly is the process, understanding what treatment can facilitate the outcome of the patient, all needs to be decided and then approved. For a patient with a severe disease where there is an organ involvement, everything, I told you, primary healthcare can be supported by all these kind of traditional things. Emergency care cannot be supported by all these kind of traditional things, because emergency care is basically intervention. It's going inside. It's not basically going outside and saying that this can be done. So it is a way, it's a process there. I think both the fraternity should come forward to come up with a plan of care and then proceed further. I think it's not a long way. It's slowly it will improve. I told you that younger generations have a thought process of adapting now ancient treatment plans. They started doing it, but the only thing is they have false data. We need to validate it. See, everything is available in WhatsApp and YouTube. Nobody knows what is right, what is wrong. So we need to make sure that everything is done in the proper way. Any questions, please?
Yes, sir. Thank you, sir. One more question from Umang Bartiwal. Can you suggest some kind of certificate or diploma in first aid which leads with?
It's a nice question, please. We will be happy to provide you with all kinds of certificates. We have certain
which deals
courses
with the emergency health situation.
We are happy to provide certificates with organizations, and all we want to this, we are already promoting it. We have been training a lot of people in emergency medicine. We do it in institutions and thing. Believe me or not, even medical school students, once they are out, they are still perplexed with how to handle emergencies. And that is a state now. We are working on it to promote emergency medicine as a specialty. So we are happy to do it. You can drop in the message to the organizers. We'll be happy to have sessions in short time if you are happy with it. And if you have number of people are there, we can arrange for courses also.
That's so nice to hear, sir, to arrange courses regarding certificates. And one more question from the question is, the patents are available for allopathy medicine. Is anything available for protecting the rights of traditional medicine system? The traditional medicine is the pride of our country.
So that is what I have already told you. Already I've discussed the answer for this, the previous questions. Patency is what there is a lot of research involved in it, and you need to prove that is right. So I think the Ayush is also working on it, and we need to make sure that such medicinal medicines are there. For example, if you go to another part in Southeast Asia, in certain countries, basically in Chinese traditions, Chinese traditional methods are incorporated in allopathic treatment to have better outcomes in primary healthcare, which cannot be denied, and it is approved, especially in Singapore. So I've been in Singapore, and I personally felt that there is a lot of good outcomes, and it has been validated by the government and is accepted. So treatment guidelines needs to be very specific, and this patency is the authority of the organization to come forward and finish the process. So till that time, it is quite difficult. Any questions? You're welcome. And I kindly need some feedbacks. If you have questions, please drop in, and you can. I can just drop my email ID to the organizers, and you can also drop into the organizers. We'll be happy to support you. And thank you for your patience listening after food. Any questions, please?
Yes, sir. One more question, sir. Thank you, sir, for answering all our questions. Tourist spots are generally crowded. What sort of problems or threats you be founded in such locations for spreading diseases?
Again, please. Tourists are crowded.
Tourist spots are generally crowded. What sort of problem or threats found in such locations on spreading diseases?
See, any tourist spot, whether the footfalls of the tourist spot is 5 people or 10 people or 1,000 people, whatever thing right now, this pandemic has brought back the olden days things back to light. See, we always make sure that we have our home food. We make sure that we don't eat outside. We make sure that we clean our hands before we eat. We always make social distancing and all these things, which we always adapt certain things. So in a tourist spot, the most important thing is basically sanitation. So sanitation is what we are more worried about. See, nowadays we have a process in place for everything. The sanitation is not much addressed. Even now, somebody travels from one part of the country to other part of the country. Especially women have a problem now. So if they go for a tourist spot, they don't have few restrooms also to the restrooms also. So they have to refrain away from all these places. Okay, they don't go for restroom at all. That itself causes a lot of trouble to them. So this is a situation which we follow, and this can indirectly, it is basically it's communicable or non-communicable. So these people have long-term problems because of these issues, because of no sanitation in any place. Or it could be a communicable disease where because of non-cleaning your hands, improper sanitation, you will have loose stools and vomiting and all these things. The most common problem which we can encounter in tourist spot is loose stools and vomiting. Because it's basically, they say it is a food poisoning. The general term is a food poisoning. But we don't know whether it can go to the next level. So sanitation is the utmost care which we need to do. And now we have the process in place. Wherever you go, we have a social distancing process. We wash our hands. We have a face mask. Obviously, this face mask is going to be in light for more than another 5 years or 6 years. Okay, until we get the herd immunity and we are happy with it, we are not going to change with this. Could you please throw an impact on? Is there one more question?
Yes, sir. There's one more question, sir. Could you please throw some light on the impact of heritage medicine on medical tourism, sir?
See, this is a very nice question. Thank you for putting this question. So there is a large impact of heritage medicine on medical tourism. So the thing is that basically it is already happening, and it is already happening in many places. So somebody has musculoskeletal issues, any musculoskeletal issues, or somebody has a lot of spinal disorders. These people always travel from one place to already. Medical tourism is, we can make sure that it is not from country to country. It could be even from region to region, or it could be state to state, or whatever it is. People have already started traveling to many places where such specific treatments are being given in a very challenging way. Very challenging way. They can even challenge allopathy treatment plans. And they have proven benefits for also things. So already is happening it. So heritage medicine is basically, you should define the way you are going to present it to the community, And as of now, heritage medicine, and it needs to be approved also, because you cannot just start a center and saying that I'm doing an heritage medicine. It needs to be approved by the government organization, that is a center which is in place, and these are the type of treatments have been given, and there is a responsible plan, workflow process or outcome based plan in that, and it needs to be submitted to the organization. If not, you cannot just promote a heritage. But there is an impact on heritage medicine, medical tourism. Once you do start promoting it, we can do it. For example, you think about transplant now. Nowadays, transplant has become so awareness has increased so widely, and onco treatment has been becoming very, very, very good now. So people are traveling from north to south or anywhere, all parts of the world they are, because we say that Chennai is one of the places which is medical tourism is very high. So this is because we have created an image of it. We have validated our resources. We have validated the outcomes, and that is what is called medical tourism. So unless until we validate all these things for an heritage medicine, so this cannot be taken to the next level. So we obviously there is a process involved in it. There it is happening, but we need to make sure that it goes to the next level. We need to spread it over the country, bring in a lot of heritage medicine available, and then do it. Any questions, please? Thank you. Kindly post your feedbacks to the people, and I'm happy that.
Thank you, sir, for
that
your valuable time and sharing with us all the, exploring the medieval medicine, the Asian medicine, and talking about the orthopedic tradition and whole health house traditional methods, and how, nature contributes to the medicine, and how spirituality and religion affects medicine and early sick life people, and how distinguished between the food and medicine, all that. Thank you for sharing with us and exploring us and all the epidemic and the COVID-19 pandemic things. Thank you, sir. And also the conservation questions of jeopardizing your significant future with regard to the health and the 6 health components, explaining about the 6 health components, and the scan screen replicate create thing, and heritage retreat centers, talking about heritage retreat centers and how emerging medical care should be taken, and how health and heritage is such a challenging thing that we should also participate and also contribute to it in order to have across the challenging thing. Thank you, sir, for once again I thank you, sir, for making your valuable precious time. We had an excellent time in exploring all these. Thank you, sir.
Thank you all, and it has been so good. I need to thank again the organizers for giving an opportunity, because this is a very rare topic which people used to give people, and I need to thank Dr. Praveen Durai for thing, and I have an attachment with St. Joseph College. It is a place where my wife did my did as an MBA there, and so it's a very good institute, and it is a heritage center, and I should thank you all. Valuable experience, and kindly post me your queries, and we'll be happy to deliver further discussions to you. Thank you all.
Yes, sir, the pleasure is ours. Dear participants, attendance link would be posted in the chat box. Kindly fill the Google form. Dear participants, thank you for spending your valuable time with us. The day 4 technical sessions comprises of 3. So technical session 11 starts at The technical session 10 starts around 8:45 a.m. So it talks about institutional heritage challenges in preserving, the case study of Sir Isaac Newton Museum and Ranipet Herbarium, given by Reverend Dr. M. Arakesami Xavier. And the next technical session 11 talks about the managing over tourism at heritage sites in India. The resource person is Dr. I.G. Gupta. And the technical session 12 talks about the life skills, which is being done by Reverend Dr. Emmanuel Arakeram. Thank you, participants, for being patient and spending your valuable time with us. Kindly fill the attendance in the Google form. I hope you all had a wonderful time today in exploring the heritage management in a WISPERS perspective manner.